alkalosis. Acidosis can be two types: respiratory, metabolic. And also alkalosis can be two types: respiratory and metabolic. When we say respiratory or metabolic, you can remember this formula: pH is equal to the pKi plus low bicarbonate to the CO2. Okay, in the metabolic part, is a respiration. In respiratory acidosis, because it's acidosis, pH is decreased. And because it's respiratory, it should be increased. So we have an increasing in PCO2, respiratory acidosis. With metabolic acidosis, because it's metabolic, is related to bicarbonate, and because it is acidosis, we have a decrease in bicarbonate. And vice versa for the alkalosis. For alkalosis respiratory, we have a decrease in PCO2 and increase in bicarbonate. They are the first which they have. But for compensation, we have to compensate by this formula. When we have a respiratory acidosis and CO2 is increased, what we should do? We should increase the bicarbonate also.
2 degrees.
How we can do the increasing bicarbonate? By metabolic alkalosis. So for respiratory acidosis, we should to increase bicarbonate, which is known as a metabolic alkalosis. And for others, you can imagine what's happening. For the metabolic acidosis, because bicarbonate is decreased, we have to decrease PCO2. So we have to do respiratory alkalosis. And vice versa for the alkalosis. Here, for respiratory alkalosis, we have decrease in PCO2. We have to decrease bicarbonate by metabolic acidosis. And for the alkalosis metabolic, we have an increase in bicarbonate. We have to increase the PCO2. And we call it respiratory acidosis. When we have an increase in PCO2, is related to ventilation. Ventilation or rate of breathing. When the rate of breathing is decreased, PCO2 is increased. Okay?
Yes.
And how we can manage it?
Breathing.
By increased bicarbonate. From what?
Metabolism.
By the kidney. We recover bicarbonate.
Can't we just increase the ventilation rate, start breathing?
No. One of the mechanisms is right there. But the main mechanism is.
Oh.
And vice versa. When we have a decreasing in breathing, actually increasing in breathing, sorry, we lose a lot of CO2. And PCO2 is decreased. For the metabolic situation, we can change the rate of breathing. When we have metabolic acidosis, we have decreasing in bicarbonate. For decreasing PCO2, we decrease the rate of breathing. And otherwise, when we have an increasing in HCO3, and we are going to increase the decrease the rate of CO2, we increase the rate of breathing. Again, I will discuss about all of this situation by the slides.
If you want to decrease the CO2, we need to increase breathing or decrease breathing?
What?
CO2 increase.
In blood,
Yes.
we have to decrease the breathing. Here, respiratory acidosis, CO2 is increased. pH is below the 7.3. CO2 is not eliminated from the body at normal rate due to the hypoventilation. Usual is actually hypoventilation. When we have actually hypoventilation, when the respiration is restricted, the concentration of dissolved CO2 in the blood increase, make the blood too acid. And this situation with PCO2 is high is known as a hypercapnia, or increasing the CO2. When we have this situation, this is severely affect the lung. Our lung cannot do enough respiration. COPD, chronic obstructive pulmonary disease, asthma, pneumonia, emphysema, or inhaling the smoke. For those guys, they are inhale smoke. The capacity of the lung is decreased. So, this is of the brain or nerves of muscle of the chest that can impede breathing. Nerve or the muscle in the actually lung, they lead to the breathing. And also, some drug, overdose of drug from opioid, or a strong drug that induces sleep, sedative. They decrease the rate of breathing.
Melatonin?
Those sedative.
Does melatonin be one?
What?
Melatonin.
I didn't get it.
Melatonin.
Melatonin?
Yes.
Melatonin, I don't know exactly. Somehow, those they are known as a sedative, like antidepressant. Okay? They wanted to give you the relaxation, and they decrease the rate of the breathing. They lead to the increased CO2. So we have here, pH is 7.3. So is acidic, basic, or normal?
Acidic.
Acid. PCO2 is a 48. Is acidic, basic, or normal?
Acid.
Is high. It means is acid. Bicarbonate is 25.
It's normal.
Is normal. So when is normal is okay. We can find out just we have increasing CO2 and decreasing pH. We call it respiratory
Acidosis.
acidosis. And uncompensated. We didn't do any compensation. Uncompensated respiratory acidosis. Here we have. And the principal causes of respiratory acidosis, we have an airway obstruction, chronic obstructive pulmonary disease, or asthma, or depression or respiratory center, neuromuscular disease, Guillain-Barré syndrome for pulmonary disease, and actually failed chest or severe other situation. Here, in respiratory acidosis, we have a decreasing pH, increasing CO2, and bicarbonate may be increased due to the compensation. The next situation known as a metabolic alkalosis. In metabolic alkalosis, we have increasing in bicarbonate. When it occurs when bicarbonate ion concentration become elevated. This can result from the ingestion of alkali material such as baking soda. You know what is baking soda?
Yeah.
Yes.
In sweet and actually bread.
Bread.
Yeah, we use baking soda. The other name is bicarbonate. Or actually losses of too much acid during the period of prolonged vomiting, suction of stomach acid in a hospital. We lost a lot of acid, so bicarbonate is increased. And also through the overuse of diuretic, when the excessive use of sodium and potassium affect the kidney ability to control the acid-base bonds. So this situation, the pH here is 7.40, is basic. More than 7.4 is basic. The PCO2 is 43, normal.
No.
35 to 45 is normal. And the bicarbonate is a 30, more than 24, is basic. Again, we call it uncompensated metabolic alkalosis. So here, in metabolic alkalosis, we have increasing pH, increasing bicarbonate, and some hope for compensation. The main reason are these, as I mentioned in the previous slide: administration of alkali, potassium depletion, and actually volume problem or volume depletion related to hypochlorite. Related to respiratory alkalosis, the last one. Because it's alkalosis, the pH is above 7.4. What is the reason? The reason is an excessive breathing or hyperventilation. And CO2 removed too much from the blood. Why we have this situation? Due to the anxiety, pain. You experience some situation related to increasing the number of breath.
Yes.
Especially anxiety when you are so hungry or so worried, the rate of breathing is increased. In the severe pain also you feel that. Low level of oxygen in the blood. In the mountain, actually, when the pressure of oxygen is low, the rate of breathing also is increased, the rate of losing CO2 is increased. And fever and aspirin. The situation, because PCO2 is below the normal, the condition known as a hypocapnia. Hypocapnia means the decreasing in CO2. Here, pH is 7.6. Is basic, acidic, or normal?
Basic.
Basic. CO2 is 32.
Basic.
Bicarbonate is
Neutral.
Neutral or normal. So we call it uncompensated respiratory alkalosis. Uncompensated respiratory alkalosis. Related to the hypoxemia, I told you that PCO2, actually hypoxemia is related to oxygen that will pass through it. And main reason of respiratory alkalosis, I told you, increasing the rate of the respiration, high altitude, mountain, severe anemia, or actually some gram-negative bacteria or other situation. I have some example here, but first one, what is the condition? Look at that. pH is 7.3. Is acidic, basic, or normal?
Acidic.
Acidic. CO2 is a 48. Acidic.
Yes.
More than 45 is acidic. Bicarbonate is 25.
Normal.
Normal. What is the situation?
It is
20? It should be 20.
the first case,
Uh-huh.
acidic acidosis,
Which acidosis?
respiratory.
Respiratory acid.
Yes.
Is compensated or uncompensated?
Uncompensated.
Uncompensated. Because the pH is low, and also we don't have increasing in bicarbonate. So, the next one,
Increase the
This basics.
Basic, what basic?
The pH is basic.
Metabolic.
Metabolic basic, metabolic alkalosis. Compensated or uncompensated?
Uncompensated also.
Why?
Because yeah, basically the the CO2 is normal and the pH is still basic, so it's uncompensated.
So,
This is gastric. Metabolic.
which one?
The second one? Yeah.
Is a metabolic alkalosis uncompensated? Is a respiratory acidosis? And here we have a hypoxia because of PO2 is. So what about this? What about that?
Acidosis respiratory.
Acidosis respiratory.
Exactly.
pH is low.
PCO2 is acidic, pH is acidic, bicarbonate is normal. Is uncompensated.
Uncompensated.
Respiratory. What about that?
Alkalosis metabolic. Uncompensated.
Sorry, which one are we talking about?
Yeah,
This one.
this one.
This is uncompensated
Alkalosis.
alkalosis metabolic.
Thank you. Finally,
Acidosis. Yes,
Acid.
acidosis. Uncompensated respiratory. No, uncompensated metabolic acidosis.
metabolic.
No, it's
CO2.
alkalosis respiratory.
Harsh.
because you forget that 35
Yes.
is the CO2.
Yes.
Oh, yeah.
Is uncompensated respiratory acidosis without any discussion. Here also is uncompensated metabolic alkalosis. But related to that, the pH is low.
Yes.
We should look at it. This CO2 is high or low?
Low, slightly low.
Acidosis.
So
When
alkalosis-
CO2 is, when pH is low, CO2 should be high.
Yes.
So they are not in the same direction. But bicarbonate is low. So is a metabolic acidosis. But because CO2 also is decreased, it's somehow compensated. But because pH is not normal, we say just partially compensated metabolic acidosis.
So it will be alkalosis if the pH was high.
Exactly.
It will be respiratory acidosis.
Exactly. We should find out. But they are so simple cases. In the actually physiopathology of kidney, you will see so complex cases and you should interpret them. But right now I didn't bring them because somehow it was difficult to explain everything. You should remember these numbers. The pH range is 7.3, 7.4. CO2 35 to 45. O2 80 to 100 millimeter of mercury. O2 saturation is 95 to 100. Do not actually imagine they are the same. The PO2 is 80 to 100, but O2 saturation is 95 to 100%. Maybe the PO2 is 80, the situation is normal. But when saturation is lower than 95, the situation is dangerous. Bicarbonate is 22 to 26, 24 is the normal. And we can say uncompensated, partially compensated, and fully compensated. Here you can have all the situation in one table together.
Could you explain the compensated and uncompensated?
Yes, again. Imagine just I will talk about metabolic acidosis, then you can talk about About metabolic acidosis. Metabolic acidosis, pH is low, bicarbonate is low, CO2 is normal, and the ratio is less than 20. When it's compensated, the actually is the same. pH low, bicarbonate low, CO2 normal, ratio is less than. When it's partially compensated, pH again is low, But bicarbonate low CO2 also is decreased for compensation. And the ratio is less than 20 again. But fully compensated, pH is a normal, bicarbonate is low, PCO2 is low, and ratio is 20. So we call it fully compensated. Related to the respiratory alkalosis, pH is high and uncompensated. Bicarbonate normal, PCO2 is low. Okay?
So do we memorize all this?
No, one of them which you memorize, the other completely is clear. But if you pay attention here, a fully compensated respiratory alkalosis
pH is always
and
low.
fully compensated metabolic acidosis, they are similar. Okay?
Yes.
These cases are so difficult to understand. You should detect which one first is decreased and the second one for that also is decreased.
Just don't ask them in the exam, no problem.
No, I don't ask you in the exam because it's so difficult. But
Thank you.
if you know the rate of compensation, you can detect that also too, like that. Here, in this situation, the maximum limit of compensation, the maximum limit of compensation is a good guidance for you. For example, in metabolic acidosis, what's happening in metabolic acidosis? Bicarbonate
Is decreased.
decreased. Okay? Bicarbonate decreased. So for compensation, what we do?
We need to decrease CO2.
Okay, CO2 is decreased. But in the maximum compensation, CO2 is decreased till 15 millimeter of mercury. So when you saw the CO2 concentration is about 15 or more than 15, it means first we had a metabolic acidosis. But when the PCO2 was less than 15, it means we had a
Respiratory alkalosis.
exactly. You got it?
Yes.
Thank you.
Thank
And
you.
for others, metabolic alkalosis. In metabolic alkalosis, we have increase in bicarbonate and we increase the PCO2. But the maximum increasing is to 15. For example, you have a case with 80. So it's not compensated by the increasing. It's due to the first reason, increasing in PCO2. So here we have a 15, here we have a 50. Related to bicarbonate. When we have a respiratory acidosis, we have to increase the bicarbonate, but just till 32 we can increase bicarbonate. And when we are going to decrease it just to 15, we can decrease it. If you remember this number, also those questions are easy for you.
Yes.
You can look at them, and if they were less or more than this number, it means they are not the second response, they are the first response. So by this actually situation is a good guide.
Is all of this to make the normal pH level of plasma?
Yes,
So the ventilation happens as opposed to help the pH level.
exactly. Exactly, is a response, decreasing or increasing in response. So let's look at this. First of all, you will check the pH or hydrogen concentration. If below
Alkalosis.
H below, it means pH is high. Okay?
Yes.
pH is high. And alkalosis is a predominance. So we will check the CO2. If it's be normal, is a metabolic alkalosis. If below is a respiratory alkalosis. if CO2b high is a metabolic alkalosis and compensation by respiratory acidosis. So if you look at that one, you can imagine for all others. I don't want to repeat them because they lead to your confusion. If I say respiratory alkalosis, metabolic acidosis, somehow is difficult. But you learn one of them, the other are easy. The other are so easy. So look at this slide and give me the
pH is high.
So basic,
pH is high,
basic,
CO2 normal.
low,
Low.
bicarbonate,
acidic, basic, basic.
bicarbonate,
It's high. It's normal
no,
from 20 to 26.
22 to 26 is normal, 24 is the actually medium. So it is
Low.
what kind of
Alkalosis,
alkalosis?
respiratory.
Respiratory alkalosis. After the end of the classes, I brought some cases, if you look at that, from the Marshall Biochemistry. It's bringing the history, examination, result, summary, and interpretation, and also discussion. These 5 cases I brought. You have to study by yourself. Okay? Everything, every information are brought here, and you can just study by yourself. For more information. John? For the final exam, I told you how I give you the question. You know, they are so similar to them, but here we don't talk about interpretation and discussion. Just I will ask you the
So do you say grid or what?
what?
Grid? Unless you would say like low pH, something like this. Yeah?
What is the case results? Metabolic acidosis, respiratory acidosis, metabolic alkalosis, respiratory alkalosis. So you should remember the pH of plasma is 7.4 and is regulated by buffers, by lung, by kidney. Buffer system of the body, they are bicarbonate, phosphate, and protein. Bicarbonate is the main one in the plasma.
And it's finished.